get this strange situation which we have in the American healthcare system, not just the American healthcare system, other health systems probably too, but much more so in the American healthcare system, of having some people who are massively oversupplied with healthcare and other people who have none. And that's not simply an ethical issue, could be, right? But just in terms of an issue of efficiency, in terms of getting the most health bang for your healthcare buck, this is a bad strategy. Right? If we want to maximize efficiency, then we might want to use a mechanism which says instead of just giving as much healthcare as we can to people who are rich enough to afford it, we should prioritize our healthcare resources to target them to the people most in need of that healthcare. Which is to use some mechanism beyond price. And the third reason, of course, not to use price rationally, there are many, but the third reason is, and I guess this is the most obvious, is issues of equity. Is we can ask, once we kind of recognize that price rationing is not natural, that it's a choice, that we have all collectively chosen to say, we're going to distribute healthcare to rich people and we're not going to distribute healthcare to poor people. That's what our decision is. No one ever says it that way, right? No one ever acts like the American system was a choice. But it is a choice that we choose constantly. We say, this is how we're going to distribute this. You people get none. You people get lots. Right? And that then poses this kind of ethical question about whether we think that's a fair way for us to distribute healthcare. And I'm not really in a very good position to make a moral argument with anybody about whether they think it's right or wrong. But I will say that the United States is beset by some pretty serious health problems. One of those is this problem here. This is the same kind of graph that I showed you before with spending, but it's the infant mortality rate. So this is deaths per 1,000 live births, okay? And over time. So the first thing you can see is, of course, deaths per 1,000 live, I should say the lines up. Okay? The blue line is the United States. The red line is the average of the other high-income countries, sans the United States, and then the bars are the extremes of other countries, of the other country average, right? So this is the lowest that any country received in that year, and that up there is the highest. It'd be easier if I was so short. This is the highest, this is the lowest. If this school was built by me, all this stuff would be on the ground. And you'd all be like slanted, so you can see it. Although that made me look shorter, wouldn't it? Yeah. Maybe there was some kind of optical illusion ramp thing that came up to it. Steroids. But, okay, so the one thing that's quite obvious from this is that infant mortality rate has been declining across all countries from 1960 to 2004, which is the last point of data in there. And that's quite obvious, and we know that. But of course, one of the things that's also happening here is that in the 1960s, the United States was kind of right at the average of the infant mortality rate of high-income countries. But what you can see, if you watch this, is that the United States is becoming increasingly exceptional. It's becoming increasingly at the high end of infant mortality rates. Until in 2000, it's become kind of outside the bounds of normal. So that the infant mortality rate in the United States is beyond normal for the other countries of the West. And this suggests, of course, a major failing of the American healthcare system. Of course, there's lots of reasons for infant mortality beyond healthcare, but it's a major one. So it suggests a major kind of failing of the American healthcare system. How can we be spending twice as much as everybody else and yet having higher infant mortality rates than everyone else? But back to the question of equity, we can ask, if we break this down, because this is the average for America, this blue line, if we break it down slightly differently and look at the rates for U.S. whites, which is now in blue, and the rates for U.S. blacks, which is now in purple, I think the results are quite a bit more startling. Let's see what we can have now. These white lines, now I'm doing it every 5 years, makes it a little easier to see, right? So these lines are still the same. You can see that the white rates are, again, at the high end of normal, right? But they're still within the bounds of normal for Europe. But the black rates of infant mortality are incredibly high. And again, they're at rates that were reached on the average in 1975, which is to say there's been 30 years of progress on this lost to American blacks. And this is only one metric of this, right? This is only one, the infant mortality rate, but it's quite easy to demonstrate this in the case of all healthcare statistics, that the United States is an unhealthy place, and more importantly, that the United States is a place that is caught in an incredible amount of health inequality. And now health inequality is caused by lots of different factors. I know it's not purely the healthcare system, but it is very hard to argue that the healthcare system does not contribute to these kinds of differences. And so I think it raises a question about whether we can continue ethically to justify a healthcare system which distributes our limited healthcare resources on the basis of ability to pay rather than real need. That's what I have to say about that. And thanks for coming. And I hope it was what you expected. I'm made to disappoint you, Mike. I know it. But you wanted to open the floor for discussion, right?
Yeah, sure.
So if you guys have questions or any comments you'd like to make, feel free. You can
So
talk
what's
for as long as
supposed
you're
to happen to us?
What's supposed to happen to you?
Yeah, with this bill.
What's supposed to happen to you with this bill? Well, as I suggested before,
What's the government planning?
coming in is I am not an expert on Obamacare. Right? That's just not my expertise. I was brought here specifically to study other countries, and I was told when I walked in the door here at FSU, you will study other countries, not America. And I've done a very good job of that. So America, I'm aware of the case, I'm familiar with it, but I'm not an expert in it. But the Obama plan is an attempt to expand access to health insurance. The basic strategy is to do that by trying to bring people who are priced out of the system back into the system in one of two ways. One is to force them to do it, and the two is to subsidize them. Why? The argument, and this, I should have mentioned this in the sustainability argument, is that one of the things that happens is that as price rises, as the price of healthcare rises, then the price of health insurance rises, right? And this causes actually a problem, which is that when you're buying health insurance for yourself, which you get increasingly, you have to do yourself because your employer won't do it for you, then you have this dilemma, which is healthcare is expensive, and you have to decide if it's worth it. Now, as that price rises, the question is, what happens to who decides to pay for it? So if healthcare is $1, most people would say that's worth it, right? But if healthcare is $1,000 a month, the question is, well, who is willing to pay $1,000 a month? Not incapable, who's willing? And the answer to that is someone who thinks my healthcare bills are going to be more than $12,000 this year, right? And if you think your healthcare bills are going to be worth more than $12,000 this year, you should get your healthcare, right? If alternatively you think, no, I'm going to go to the doctor once or twice, but otherwise I'm going to be fine, then you shouldn't pay that price, right? So what happens is as the healthcare costs increase and insurance costs increase, healthy people drop out. Healthy people stop playing. They stop participating in insurance. But this then causes a problem for the insurance industry, right? You can't run an insurance fund with only sick people in it. It's not possible, right? Because if everybody in it is utilizing tons and tons of health care, then you would need all of them to be paying for themselves. The only way health insurance works is if you have healthy people who are paying in, right? And then you have sick people who are having to pay out, but you need more healthy people paying in than you have sick people paying out. But if the costs are rising, more and more healthy people will fall out. And of course, as more and more healthy people fall out, then the health insurance system the health insurance company to maintain, to stay afloat, has to raise rates. Right? They have to charge all the people who are still in more money. But of course, if they charge those people more money, the rates go up. So the healthier people in the pool say, well, the rates are too high, to hell with it, and they drop out. Make sense? So this creates a cycle. And this is what insurance companies are currently in. They're currently in this cycle of healthy people like you will not buy health insurance. It's not worth your money. You can't afford it, and it's not worth it for you. And part of what the Obama plan is to get people like you to buy health insurance by forcing you to do it.
That's taking our money.
It is taking your money. It
No,
is.
straight up.
Right? But the argument is that by forcing healthy people to buy into health insurance, that the